For today's webinar, Baton Rouge General Medical Center improves patient experience and safety with positive patient identification technology. I'm Steve Murfitt with Imprivata, and I'll be your moderator for today's session. I'm joined today by Douglas Burkett, Senior Systems Analyst at Baton Rouge General Medical Center. Hello, Douglas, and thank you for being here with us today. So in just 1 minute, we're going to pass the baton to Douglas. First, I want to cover a few quick housekeeping items for our audience. Today's webinar is being recorded, and you receive a link to the on-demand version via email within 1 to 2 business days. You are free to share that link with colleagues as well who are not able to attend today's live session. So if you have any trouble with audio or video today, your best bet is to refresh on your browser. And if that doesn't work, you can try logging out and logging back in again, which will resolve the issue in most cases. And finally, we will have a question and answer session at the end of today's presentation. Please feel free to ask questions at any time via the Q&A panel on the right-hand side of your screen. Use the Q&A panel and not the chat panel. We will leave time at the end to get to everyone's questions. So as we see them coming in, I will do my best to weave those into Douglas's presentation as they fit. That's enough from me, so I will turn it over to Douglas. That's yours.
Good afternoon, everybody. Douglas Burkett from the Baton Rouge General Medical Center. Yes, when the Baton Rouge General implemented Imprivation Secure with the Paragon system, and let me go in here. Basically, just want to cover is just a short Baton Rouge General Medical Center and introduce Patient Secure, and then the Patient Secure, and on a little understanding of how the biometrics involved Patient Secure work. Talk about the timeline that Baton Rouge General followed, and implementation with Patient Secure, and the actual demonstration of how Patient Secure works within Paragon, and then about our patient acceptance, and kind of what your holds, and then have some questions and answers. The Baton Rouge Center is located in Baton Rouge, Louisiana. We have 590 beds with it between 2 campuses. We have a standalone rehabilitation hospital, 20 physician clinics, radiology imaging centers, an outpatient endoscopy center, and an outpatient behavioral wellness center within our organization. Basically, we'll heal, lead, and our communities to live the healthiest lives possible. And our mission is to create exceptional experiences and value for the people we serve through health and healing. Now, the basic reason for us in Baton Rouge General Medical Center to search out solutions for the secure fit in that area is duplicate medical records and their impact on patient safety. We were in a process to clean up duplicate medical records, and we were working on, this is pre-Paragon days, and we were working on clean up, and we developed an aggressive program to clean up, and we actually reduced the rate of duplicates from 4.8% to 2.8%. And we were on the cleanup program for a couple of years, and we really just were correct duplicates on the back end after the problem. We need to try to reduce the duplicates being created in the first place. And in the process of implementing Paragon, we talked to McKesson about can we have a solution, and we investigated on our own and found that liked the idea of a biometric identification system on the front end and Essen was willing to work with Patient Secure to integrate that within the Paragon system. So, Imprivata Patient Secure, basically Baton Rouge General was the first Paragon hospital in the southeastern United States to implement Imprivata Patient Secure. Imprivata Healthcare Technology Leader, providing the latest innovation in patient identification management, company's flagship biometric patient identification platform. On to the number, volume of what we do. Patient solution basically works with linking a palm to an electronic medical record, a one-for-one match. And they can accurately identify any patient at any of care throughout the system. And then it retrieves the correct record upon the palm scan.
We're getting a question about what do you mean by palm scan, so I can speak to that just a bit. It's an infrared beam of light that actually looks at the unique blood vein, the vein pattern in your hand. Like a fingerprint, like an iris scan, it is a unique biometric identifier. That's relatively new to some of the folks on the phone, so I just wanted to explain that for them.
Yes, there will be a couple of slides shortly that will go into a lot more detail.
Perfect.
And the benefits of Imprivata Patient Secure, basically it improves patient safety by reducing the chances of duplicates and overlays. And also there is the benefit of it can reduce fraud and identity theft. I'm familiar with that. Also can enhance patient satisfaction because it is utilizing technology to help keep the patient safer. And a lot of our patients have realized that, and they actually like the system. And we can reduce duplicates and reduce errors. We can then have a revenue cycle at the same time. So, Imprivata Patient Secure here for General in our very preliminary numbers. We've been up on Paragon and with Patient Secure for a year and a half now. So it is at the time our preliminary number showing that a 20% reduction in the creation of duplicate records is what we're experiencing. And what we were looking for was a significant reduction of the creation of duplicates, and that number will increase also. Reduction of medical identity theft and insurance fraud. The patient palm scan should experience reduced registration times and a very tight integration with Paragon, which provides full functionality with minimal workflow modifications, and you'll see that when we do the demonstration. Patients and the biometric basics. This is how biometrics work and how Patient Secure then pulls that technology into their system. The Patient Secure works by scanning with the vein pattern of your palm. The pattern of your palm is highly unique to each person. Advanced uses the vein pattern to create an encrypted and protected digital file which is linked to the patient's unique medical record. Palm authentication works by comparing the pattern of veins in the palm of a person being authenticated with the pattern stored in a secure database. Patterns are unique to each individual. Even identical twins have different palm vein patterns. Since the vascular patterns exist inside the body, they cannot be stolen or duplicated. Their method of biometric authentication more secure. Little graph show the palm vein pattern scanner, and palm is placed on there. Now, the second picture, the one on the right, printer is a hand guide. The actual camera is just a little, probably 1.5 inch by 1.5 inch infrared camera that's located in the bottom. The whole unit is not a camera. Just the camera is at the bottom, and it puts out infrared light used as a picture. And basically, these graphics here will show you. Here's palm. This is what it looks like in an infrared, and it extracts a palm vein pattern, and it creates an algorithm based on that, which it makes a unique algorithm, which is assigned to the medical record. And that way, it's a one-for-one link. So then, at that point on, when and that palm vein pattern is scanned, that medical record. This infrared light that is used in this is safe. If patients are concerned, it's very safe. It's basically the same light that you use in your TV remote control devices. So, very safe. Vein patterns, some of the more basics on the system. Palm vein patterns cannot be compelled. So, I mean, we have in the emergency room with HALA regulations. We cannot deny services based on someone not giving, but we make the little patients and then let know that this will help them and help us identify them. The default, and always ask, can I use my left hand or right hand? Well, it's better to have a default that you always use a certain hand, because each palm vein pattern is different in each hand. So if you used your right hand and your left hand, at times you could show up as two different people, and that's exactly what we don't want. That's what we're trying to do, that possibility. So there's the right palm. We'll use only if the right is not available or readable. And if palm presents a readable pattern, the patient will be identified by existing means of the patient photo. When in the demonstration, the system is integrated into Paragon, it's removing of the Paragon for searching for and finding patients manually. It augments it. So if a patient is unable to use their palm vein pattern because of, say, stroke or arthritis, we have other ways to search through in Paragon and find them and identify them just as you would do without the Patient Secure product. So it's augmenting the system. Now, the government-issued ID presented for the patient to be included into our Patient Secure system. I want to just make sure that the person is who claim to be before we add them to Patient Secure system. This system is not recommended for children under 5 years of age because the palm pattern is so small, and also it's very difficult to get someone under the age of 5 to keep their hand still long enough to get a good palm pattern. 5 to 14, recommend that patient is scanned once a year. The palm doesn't change as patient ages. The way it presents, because the size of the palm is growing, the way it presents does change. So it's recommended that they be rescanned year until about age 14. There's a setting within the Patient Secure system that if the patient is within that age group and prints in their scan and the on record is over a year old, it will prompt the registrar to make a new scan. In line with Patient Secure is we went live with the McKesson Practice Plus system in our mix in October of 2013. And February 2014 is when we went live with Paragon June of 2014 when we went live with Patient Secure with Paragon. In 2014, we actually implemented a program of enrolling some persons at some health screenings and fundraising events, because Paragon allows you to have person records even if the patient has not had a bit within your hospital. You can create a person record, associate a palm scan with that person record, and then when the patient does come in the hospital, they're already set to go. So we're going to take advantage of that in some video events. In July of this year, we have 2,000 total enrollments, and we've reached positive identifications exceeding 140,000. And in August of this year, we added our rehabilitation hospital, and we had 2 imaging centers, which basically we went live with imaging centers with Patient Secure and Paragon from day one. Prior, we had always, the people gone up with Paragon, and then we brought in Patient Secure later. We decided to then do it from the beginning so that registrars really didn't know any other way. And that process seems to be working. Currently, our Patient Secure system, with the 8 palm scanners deployed, we're in 21 physician clinics, 6 hospital-based admissions or ancillary registration areas within 3 hospitals, and our enrollments, as of just a couple days ago, we were over 60,000. We have a population of a little over 500,000 person records. So of that, we've already scanned 60,000, and we have positive identifications of over 184,000. Real quickly, what the difference between enrollment and the positive identification is, and I'll show you when we do our demonstration. Enrollment is when you're enrolling a person for the first time in Patient Secure and linking them with that record. Every time the patient comes in for presentation for services, it's then a positive identification. So when they come in, they're identified, it pulls their record up each and every time, and that's a positive identification. And from a statistics standpoint, those are more valuable to us than the enrollments. The enrollments tell us we've got these people enrolled, but the positive identifications tell us they're coming back and the system is being utilized. So the positive identifications are a very valuable number. Now, what we do with the to develop with Paragon, the development staff, it was a collaborative effort between the Paragon development staff, a lot of Patient Secure, and Baton Rouge General Analysts. Baton Rouge basically just provided workflow guidance, and we did the initial testing, and we functioned as a beta site. There's a patient there that is running in the system tray, and there's a blue secure blue icon replacing the Paragon search button, which calls Patient Secure from within Paragon, so the integration is practically seamless. Those who are familiar with Paragon, with the screen here, there's usually an arrow where that blue palm is. That replaces the blue palm, replaces that search arrow. Now, Technics for Patient Secure, this is a 2008 server. There's HL7 interface that goes from the Paragon end that sends all ADT messages, contain enterprise person number. The interfaces between Paragon and Practice Plus and Patient Secure allow us to have patients that are enrolled in one system identified and identified in the other. A patient comes into one of our hospital-owned clinics to see a doctor enrolled there. The doctor says, well, I need you to have some lab work or x-ray done at the hospital, and they come over to our hospital, and then they're scanned. It's basically a positive identification and pulls up their record immediately. They're enrolled at either the hospital or one of the clinics. They're enrolled in the whole Patient Secure system. So that makes it very good for us that it's just one system that can allow entry point into our different AIS systems. Each works in these Windows 7, 16-bit or 32 bits, and does require 2 USB ports. Just a little non-powered USB hub, because we have LANs for USB devices on our registration workstations. Secure is set up within Imprivata. A user needs to authenticate 2 patients to secure the server. We currently use Active Directory for our identification. Security, there's 2 settings for in the biometric authentication scan functions, and these be set to yes for user, or we actually created a group to take care of that. And settings, one is for registration and the other is for the emergency department, because Patient Secure is integrated in Paragon registration, and if you use the emergency department management software module. Here's just an example of where security, where the biometric setting is. Now, basically, Patient Secure is integrated in patient registration and emergency department management software in the patient search area. The PALM is associated to the Paragon EPN in the Patient Secure database. Also, that Paragon EPN is shared with our McKesson Practice Plus systems. That is the point that is identified by the EPN. That EPN is then tied to the PALM scan. So that PALM scan point scan, which then says whether the person is in Practice Plus or whether the person is in Paragon, we locate them each and every time. When we're registering, the patient is asked for their date of birth. The Joint Committee recommends that we have 2 point identification. One is the date of birth, and the other will be the PALM scan. Now, as I said before we do a PALM scan on a patient, we get a government-issued ID. So that way we know the person is who they say they are. We associate the PALM scan with their record. From that point forward, we use the date of birth and the PALM scan to identify them. The data is secure, and then the patient is asked to make a 5, place on the scanner and moving it forward until it hits the stops. Patients already are enrolled, their person visit record and the visit history will display. If they're not already enrolled, the patient will be asked for government issue photo ID. Patient Secure will put the register to enroll them in the registration process. Because functionality of having a person record that's not associated with a visit, it's possible to enroll a person in Patient Secure through one of our clinics or who may be through welfare screenings through Paragon. So their existing person record will be found. Now, basically, quick definition of how a identification of an existing patient works in the registration system, and then the emergency management system, and then I was going to show how an enrollment works. Basically, I'll pull up our here this PALM will wait at the patient care system. So basically,
Doug, I think you need to share your screen so we can see. Right, we're looking at the slide. Hang tight. Transition. Now we're live.
is the Paragon patient registration system.
Fantastic.
The blue palm I was speaking of earlier. The registration. This is a secure system, so you can see it is then integrated, where you're clicking on one button in Paragon and it brings up the entry here, the system. The patient will be asked what their date of birth is. For my example here, date of birth is going to be 01/01/1960. Accept. Scan. And I'm putting my palm on my on the scanner. Then he pulls up and identifies. You can see it says success. Their ability in Patient Secure to have a patient photo with here. You can see Paragon screen behind, and those of you familiar with Paragon, if I patient search, I'd have a patient name here and their visit history here. You can see it is blank. I hit S, and it populates. So here, test 01/01/1960, they are, here's their visit history. Registrar will then immediately see there's a pre-reg event that the patients come in for. They would then utilize it, do that visit, and do their check-in as normal. So if the patient, based on their palm scan and presenting the date of birth, that is the rest system. The management system works similar. In the e-management system, the initial entry is done here in the person's screen. Here, normally, where the registrar would enter in the person's name and date of birth, but there's a blue palm over here on the right side. And it's the same process as before. Ask the patient their date of birth. Start scan done here, and then you see the patient is here in test. I double click on this person, and the registration process within the ED management system. If a registration or an enrollment, a person that had not been here before, similar but a little more involved. If the person has been here before, I would come in and I would ask them what date of birth. Now this patient that I have this example, date of birth, I do 14. And it says find me. Now, what we instructed our registrars to do is if they believe that the patient had their maybe not positioned properly or whatever, they can do the retry of the identification and click yes. That'll just walk them the same process. But if the patient's palm is down there all correctly and the patient's just not in the system, they click no. Anyway, brings them back to Paragon. You can see the blue palm is still there. They will click this bypass scan box, and you can see the blue palm disappears, and now we're back to the little arrow that Paragon comes with as normal. I will put the patient's name and date of birth, usually by getting a issued ID, put a name and date of birth, do a search, and here is the patient that I went in for a pre-reg event. Now, if I click on the person record to want to verify, their address or, make sure we have the correct address and phone number for them, you'll get, it says, is this the same patient you attempted to identify with Patient Secure? Yes, it brings things are in here we can identify, verify with the patient, yes, they still live, address with phone number, okay, and you'll get this box here, which then it's just secure, confirming if you wish to deal with this patient here. Test, date of birth, accept, and this starts in. Places their palm down. Bottom of the patient secure scan, it now says, please ask the patient to lift their hand up. Lift their hand up about 4 to 6 inches and ask it to put back down. Now it needs to talk the patient through this. And successfully now added test with date of birth of 2/14/1985 to our system. No photo available because of the brand new patient. We can photo. Okay. Demos.
Well, while you're taking a picture, we actually have a question that came in out of scenario if the patient gives a different name or date of birth. Hello, we can see you.
They'll capture, and there's a picture. Save. Now, this picture is associated with this record. Yes, and it's going to bring you right back here. Now, at this point in time, that patient is now associated with that record. And from now on, they come in, they present the date of birth, present, bring it up. And the question again?
What happens if the patient gives a different name or date of birth? The palm scan matches an entry in the database.
If there is a palm scan entry that comes up, if there's a palm scan that matches that entry, we'll provide a warning message, and it says that the palm scan is already in use. At that point in time, we've instructed our registrars to register the patient manually and make a note of it and let us know, and we'll try to research what is going on. Usually, it's a case of an individual is a little confused, sometimes with their birth. Have that happen sometimes with some of our population in the emergency room, where they might be a little confused, and we'll try to get to the bottom of it. We override the system. There's already been a palm scan done successfully, so we'll try to research what is going on and determine the cause for the issue.
And yeah, there's the ability for that ER to enter a date range if that person is unconscious or is to
right.
be.
That is the last thing I want to demonstrate is one of the nice features of the Patient Secure system. They have called the search. Interesting. Well, I'll demonstrate the trauma search function. As I said, I love live demos. It's not coming up right now. Apologies for that.
Want to explain how it works?
Yeah, basically there is a, when you secure function, there is another button down here that comes up and says trauma search. You click on that button there, and another screen, and the screen basically says what approximate age of the patient and their gender. What Picture will do at that point in time. Now, for example, when I had a patient that was was a date of birth of 01/01/1960, and say, well, they're approximately between 50 and 60 years of age. So I would say 5 years of age. What Patient Secure is going to do is going to take that palm scan that we're taking from the patient and do a search for all dates for plus or 10 years from the age that we do. So it's everybody with a date of birth that would be 45, I say 35, from 45 to 65 years of age. All male, if male in that case. And that's strange, and it will then bring the patient up. It's useful in identifying a unconscious or an unresponsive patient that comes into your emergency room. It's designed to be used in the emergency room and really only under those circumstances, because it is it's a search intensive. It does take where how quickly the response was on scans doing a single date of birth. It may, in our database, it may take anywhere from 30 seconds to a minute to come back with a search. We just on the search. So
you compare that to the process of an unconscious patient, you create a new medical record on the spot, correct? And after the fact would have to go back and realign that medical record with that person once they came to.
That is correct, and we're faced with that 7 times a month currently, and we've not yet had a case where we found a patient that has already been enrolled in our system that has come in the back of the emergency room through an ambulance and been unresponsive. But we are working towards that, and we're hoping to have a success on that future. And I've people before, and I'm very serious about it. It happens. If we have a patient that comes in through our ambulance, through the back of our emergency room, and we identify them, within 3 to 5 minutes of that patient coming in, and no identification of this patient, and we can turn around and identify it and give that doctor history and allergy history and everything on that patient. I have a system.
Oh, absolutely. So a question here about what happens if the patient has no limbs, and I can answer that. I mean, essentially, you would follow your typical registration process, and you can bypass the scan.
Well, the screen, when I hit this bypass scan, that basically allows you to do a search as normal, and you would do our normal criteria that we follow is 3 characters of last name, 2 characters of first name, and date of birth. And if available, we have some other criteria we use. But that is how we usually do our searches. If the patient has no limbs, or if their hands are not, if they have, rheumatoid arthritis and their hands cannot be straightened out, no way do we want to embarrass the patient or, try to make them work with the pulse system. Our registrars are trained to then, see a situation, they bypass it, and they do the search manually. Actually make a notation in our Paragon system that, the search was not done, and this was why. So,
thank you.
Let's back to the
top of the screen.
yeah.
That's all the way up.
There. Here within the slideshow, I'm going to be skipping screens through. Basically, as a backup in case the work, had some recorded sessions in here. So here on our patient acceptance, and truthfully, patient acceptance has been very high, and the feedback from our patients has been positive. I was expecting a little bit more resistance than what we actually experienced. We make it very clear that the system is voluntary. Our patients do see it that it's a mark that we're utilizing technology to then modify them and help keep them safe. Some of our patients are so comfortable with the system, and they're coming on a regular basis, see their doctor, they literally walk up to the counter and put their hand down and give the registrar their date of birth. I mean, they know how the system works and utilize it on a regular basis. Now, we occasionally experience some reluctance and some outright refusals. We have registrars have been given a brochure that they can give these patients, and in cases the patients, after they read the brochure, change their mind and come back and want their palm scan taken. But again, it's a voluntary process. There's no way of these people for doing it. Now, actually, we have some positive news coverage about our system. And here's a brief quote from our VP in one of the turn control back over to Christy, so you can show a brief clip.
And this is really phenomenal testimonial to what you just said in terms of the patients are really seeing this type of solution as a value to them, and the fact that you get positive press coverage as a result. Phenomenal, and actually in line with many of our other customers. But let's take a look at the video clip. So here we go. Okay. Now, hopefully you all were able to hear that through your PC rather than the audio line. If it was quiet for you, apologize. That didn't come through the telephone, but it was on your PCs. What I just wanted to comment on is the thing that's been so is as our customers have rolled out this solution, that is one example of literally dozens that have received local press coverage, and much of which has been prompted by the patients themselves through the patient experience of one just being impressed and intrigued by the technology, but then realizing that why it was put into place and how it is protecting their private health information. So thank you for sharing that, Douglas, with us.
And to wrap up, we'll do some questions here. We'll have okay. The thing is that we get a lot is the cleaning of the palm scanner unit, and the CC has advised that the patient's care hand guide, which is the black casing around the scanner itself, falls in the category of non-critical healthcare equipment, which is similar to a doorknob or a countertop. So while we follow these cleaning guidelines, we use the 7% alcohol disinfecting wipes. Between patients, we wipe just the very top of the scanner off where the hand comes in contact, and then we actually, about once every couple of days, we provide the registrars with a clean cloth, which they use to then clean the glass surface of the camera inside the scanner. Just the hand continues to be good. Andrew holds 4 back general. At the end of this year, looking to implement some mobile carts in our ED, which will then allow us to do the ED trauma search that we talked about on a more efficient basis. The patient photos that are collected in Patient Secure currently really stay in Patient Secure. We are working with Paragon. Patient Secure has been very, very good working with us on this, and Paragon. So in Paragon release 13.1, which is not out yet, but it was been slotted to be in 13.1, that would be transferred from to Paragon, and then put in some Patient Secure Patient Works self-service kiosks in 2017. Which our interface will be available at the time of 13.1, and those kiosks are triggered by the palm scanners. We would have requested from Paragon some enhancements to the ED management workflow, allow us to hit the Patient Secure system from in the ED management system, other than the Quick Reg right now. When they do the initial registration is the only place that we see the Patient Secure. We would be able to come back to a patient if for whatever reason we didn't get it initially, and get them scanned at a later time. And just a thing that we've been talking with Paragon about is the possibility of putting Patient Secure into some other areas of Paragon to then positive patient identification. But that's all just basic just thoughts. So, and that's questions, Christy.
You just answered one of them. Thank you very much. Folks had questions about the photos. And we had a question earlier from Stanley, who's been patient. Thank you for waiting. Back to really one of the first things you talked about. His comment was some institutions might be satisfied with a reduction of duplicates from 4.8% to 2.8%, given that the national average hovers around 10% or more. So what was the impetus for Baton Rouge wanting to go further? And were there prominent or specific problems that made duplicate records a priority for you?
Basically, not satisfied with, we weren't satisfied with 4.8% or 5% or 3%, or we're just not satisfied. Our impetus is to and get our processes to be as safe as possible. Patient safety is our #1 concern, and we know that we will never totally remove duplicate records, but we are committed to reduce them to an almost negligible amount. And what we realized is we could work and have a team working on cleaning up the mess. We're doing excellent at cleaning up the mess, but we're creating duplicates. So anything we could do to reduce the number of duplicates would make our patients even safer.
Yeah, I think the underlying comment there, I mean, you're talking about, duplicate medical records, patient safety issue, and when you start thinking through the real primary concern with a duplicate is that you don't have my full medical history available to the clinical team that's treating at that moment in time. So for somebody who is allergic to contrast dye, and that's not in medical record that's pulled up, it's in the medical record associated with my name, for example, there are serious adverse effects that could occur. And with 10% of medical duplicate records being created, 6% of those there is a adverse event that can cause harm to patients. So that's the which you're speaking to, that you aren't satisfied. Baton Rouge isn't satisfied with me because it is a patient safety issue. We question here about support, implementation support, and you talked earlier about the partner in development. Could you describe the level of support you needed from Imprivata and McKesson and his role?
Well, basically, I can't say enough good things about the Patient Secure folks and the Paragon development people that I worked with. And I've been an analyst in healthcare for more to think about, probably almost. And it was really a pleasure to do this project. We did a bunch of workshops over the phone, WebEx type work sessions. We did workflow. I basically made my recommendations as to where I'd like to see the Patient Secure implemented, at what point it should enter the system. The Paragon development people would do their piece. The Patient Secure people would do their piece, and then we'd meet back and we'd do a little testing and say, well, no, maybe that's not sufficient. Let's try something else. And we worked through that for probably about 6 weeks to maybe 2 months. And we got that process working, and then we went through some beta testing, and then it went to the eventually being in a GA status. So what we did, and like I said, I just can't say enough good things about it because the project worked very well. Everybody worked well together, and result.
Thank you for that. One of the other questions, which I believe you addressed earlier, was about the patient who was enrolled in the system at the hospital could also be identified in the clinics as well, right? So this wasn't just a single facility.
Correct. And we found that to be a very attractive feature of how we implemented the system, because our clinics are on the McKesson Practice Plus system, and we the implemented there is slightly different. Practice Plus is a little older system than Paragon, so it's using a screen scraping technology for the Patient Secure to work, but it still basically functions as the same way, where the patient is enrolled, and then once they're enrolled, they come up, they provide their date of birth, and it pulls up their information within Practice Plus. we, and once they're enrolled in either the Practice Plus system or in Paragon, they're available immediately to any other system. So within our network. So they're can literally be doctor's office, get ripped for a lab test, come to hospital, and some clinics are attached to our hospital. It's only a short walk, come to the registration area and get registered for their lab test, and their secure record is pulled up, of them leaving the script. So it's all integrated and work very, very, very well. If you have systems, I'm sure that the patient secure people can work with getting the information to other solutions. Like I said, we got everything working, and we have two systems that are talking and sharing the same database of palm scans.
That actually addresses the last question that came in, is, Bravada designs solutions to support the workflows of multiple facilities. We fundamentally understand that mergers and acquisitions, and there are different infrastructures out there. There are different EMRs and there are different ADT registration systems. So this clearly has been an example of the integration with McKesson, but we do have integrations with multiple ADT registration systems, including Epic, Cerner, Siemens, and Meditech. So that is one of the questions that was presented earlier. There are a couple more questions, but we are hitting the top of the hour. So what I will do for those of you that didn't get your questions addressed, we'll follow up with you after this event. We really appreciate you being so actively engaged, and really appreciate your time, Douglas. It was an excellent story that you got to share. We appreciate actually seeing the product live and in action, and having some coverage to show for it. From from everything I heard from you, as a partnership with vendors and Baton Rouge to get this system integrated into your existing workflow and existing systems to decrease those duplicate medical records and improve your goal around patient safety. Of other benefits, but that's what I heard you call attention to. So thank you for sharing your time. Thank you again to everyone for joining us on today's presentation. We will follow up and get you this recording. Have a great day.
Thank you.